From the TBD studios, let's talk live with your hosts, Natasha Barrett and Melanie Hastings.
Of my heart, oh my heart, oh my heart.
We've been talking all month long about heart health and what you need to know to stay healthy and safe, but one of the biggest issues with heart health is the lack of knowledge. Well, many people think of heart disease as a man's problem. Women can and do get heart disease. In fact, it is the #1 killer of women in the United States. Dr. Rachel Berger is a cardiologist with the Cardiovascular Group of Northern Virginia and has more on what we all need to know. Good to have you here today,
Great to be
Dr.
here.
Berger. And as you know, February is Heart Health Month, so we're continuing to keep our eye on this problem. Let's talk about how heart disease manifests itself in women specifically.
Absolutely. I mean, we know that heart disease is the #1 killer in women. It affects, more women and kills more women than cancer, lung disease put together. And women often don't recognize their symptoms. So often we learn that symptoms of heart disease is sort of clutching chest pain. But women often present differently. In fact, one study showed that only about half of women present with chest symptoms. More often they present with, shortness of breath, fatigue, just not feeling right, nausea.
Well, that could be every day. Hello.
Absolutely. Symptoms that could be masked, as other things. And so women don't recognize their symptoms.
So, I would think that fatigue or even shortness of breath, those are kinds of things people could have on a daily basis. How do they know when it's time to call 911?
It's hard to know. It's hard to know. I always tell my women patients especially that you know your own body the best. And if you feel like something is different, if you feel like something is not right, then you should get out there and seek medical attention. You should see your doctor. If you think something's going on, you should call 911 and get to the emergency room, because you don't want to miss something.
I see you brought your heart model with you today. Can you tell us what happens during a heart attack?
Sure. So a heart attack, the heart has 3 major blood vessels that supply blood to the heart muscle. And over time, people have cholesterol and calcium and sort of junk clogging up those blood vessels. And if you have that filling up your blood vessel, at some point you might get a crack in that plaque and a blood clot could form. And if you get that, you get basically a stoppage of blood in that blood vessel, and that piece of the heart tissue won't get oxygen and won't get a blood supply, and that's what causes a heart attack. So it's a collection of cholesterol and fat and calcium that fills up that artery, that cracks, and a blood clot forms.
So with most of the coronary heart disease in women, is this the main issue? It's that we're ingesting too much cholesterol?
Well, many things increase your risk of forming that plaque and developing heart disease. There are major risk factors, things like diabetes, high blood pressure, high cholesterol, living a sedentary lifestyle, being overweight. All of these things significantly increase your risk of having heart disease. Smoking, eating a diet that's rich in cholesterols and fats, all of these things will increase your risk of developing that plaque and having a heart event.
What about family history?
Family history is extremely important. When we talk about family history, we're particularly talking about early heart disease in first-degree relatives, mothers, fathers, siblings, but any heart disease is important.
Since you see a lot of heart patients in your career, what would you like people to know, since it is Heart Health Month? How can we better take care of ourselves?
Well, the first thing is to be aware of your symptoms and be aware of how you're feeling. And if you're feeling something that is unusual, that you should seek medical attention. And it's really important to be your own advocate. So, when women show up to emergency rooms and they have symptoms that in the end turn out to be heart disease, they are less likely to get an EKG, less likely to get a cardiology consult, and more likely to get an anti-anxiety medicine, because their symptoms can be so different. So you really need to be an advocate for yourself. And if you think something is going on, you need to call 911, you need to get into a medical provider. And then there are so many things that you can do for yourself. You can have routine physicals and be screened for things like high blood pressure, high cholesterol, diabetes. You can get out there and exercise. the guidelines recommend at least 4 or 5 times a week, at least 30 minutes of moderate intensity aerobic activity. You know, getting out there, moving, and eating a heart-healthy diet.
Lots of good ways to take care of ourselves. Thanks so much for giving us all that great information, Dr. Rachel Berger with the Cardiovascular Group of Northern Virginia.
Thank you very much.
Well, Lindsay Lohan, yeah, we're going to talk about her. She's getting ready for her next court appearance. Find out why some people say she's going away for a long time. And if you have something you'd like to say, you can email us at letstalklive@tbd.com. We'll be right back.
I realize nothing's broken.